Hey everyone, we are thrilled to be bringing new information during these coffee chats, and as you know, our goal at Dermatology Consultants is always to bring the most cutting-edge technologies to treat even the most common of diseases that we deal with every day in our clinics. So we're particularly excited to be adding AviClear, which is a laser that you'll learn a little bit more about in just a second, to treat a very common problem of acne vulgaris or acne. And we are the first practice in Metro Atlanta to have this, and the only one. So we'll learn a little bit more about it. We hope that you'll take advantage of this. I have to plug our event on October 20th that's coming, because this particular treatment will also be included in these wonderful discounts that are coming your way. So first and foremost, let's learn about AviClear. I have with me Jennifer Avaliani, who's our senior physician assistant, who's been working with me for the last 20 plus years. And Jennifer, let's talk about, before we get with other Jennifer about AviClear, let's talk about the patients that you see in the clinic that you think would be so appropriate for this and why.
So I am so excited to have this technology. As Dr. Paré said, we're the only ones in Atlanta. I see tons of acne, and acne can be very hard for patients.
Right.
We have tons of different treatment modalities that we've had for many, many years. A lot of them come with some side effects. We use them all, and a lot of times they're very effective. However, it's nice to have a new tool with no side effects. This tool is super exciting too, because it can be used on all ages, all skin types, very effective from just mild acne all the way up to severe acne. No downtime, nothing that we warn patients about with it. So having a new tool in our arsenal that is effective, safe, and can be used on everybody is very, very exciting.
So Jennifer, when you talk to patients in the clinic, what is the typical conversation when a patient comes and presents with acne to you? Do you start with topical? I mean, of course, it depends on the severity of acne that present, but talk a little bit more about what is your thinking process typically when you approach an acne patient?
So I tend to be very communicative with patients. I tell patients it has to work for you. If I give you a pill to take every day, but you can't swallow pills, it's not going to work.
Right.
So I have that discussion. I tell patients basically these are your 4 options, and I go through those 4 options, whether it's topicals alone, oral antibiotic, hormonal treatment, or Accutane. So I'm so excited now to have a 5th tool to add in. It's got to work for the patient.
Right.
So based on
and I know that, and we'll get in with other Jennifer in 2 seconds about how this really works, but I see a lot of excitement in patients that typically may be considered for Accutane, and there are such concerns about this medication. So have you started the conversation with patients, they may be in college, they may be worried about taking an oral medication that may limit their function in many, many different ways?
100%.
Yeah.
So again, those antibiotics, Accutane, that definitely has a place, but not for everybody.
Of course.
So for people who can't do that, it's going to limit their daily activities. This is a great option.
Well, let's talk about this particular tool. Welcome, Jennifer. Thank you for finding the time this morning, and talk to us about this great new option for acne treatment.
Yeah, thank you so much for having me. It's something that Cutera has been really excited about releasing AviClear. The wavelength that we're using is a 1726. It's actually been around for quite a while. The big challenge was how do you harness that and make it comfortable for the patient. So we've been able to do that really by utilizing that wavelength, that it absorbs twice as much energy that sebum does than water, right? So when you pair that with the cooling sapphire tip, you really protect the skin around it at that surface level, but you're able to drill down and really target those sebaceous glands, which is the root cause of acne, right? And the greatest thing is that it, like you've mentioned, there's really no side effects. It is a great alternative to traditional methods that can take time, can take compliance, can take really, some time out of your everyday life, right?
Sure.
And cause some real concern. So really 3 treatments, it's about 30 minutes per treatment. We treat about once every 4 to 6 weeks. And we've seen some amazing results through our clinical trials, but also in real life practices across the entire country.
talk to us a little bit about the percent of response and how long do these results last?
Great question. Yeah, I mean, during our clinical trials and kind of what we've seen as we've done our launch, we've had 0 non-responders, which means everyone that has gone through this treatment, whether it be their first treatment, their second treatment, or have completed the series of 3, they've noticed a difference. 87% of the people that have been treated notice a 50% or greater reduction in nodule size and also nodule number of nodules within 6 months of that first treatment. So really, truly incredible to be able to take someone that may be suffering with severe acne and take them down a couple of grades in a couple of months. It's amazing.
That is amazing, and pretty good longevity of the results. I mean, I think we in the practice do have many tools that help with maintenance. It's not to say that you won't be seeing Jennifer or many of our other providers in the clinic for maintenance recommendations for topical therapy at times. But this is really remarkable, and I do believe that this is changing the way that we are beginning to approach the treatments with acne. And also I'm finding that I'm sending a lot of adult women with perioral dermatitis. That tends to be a little bit of a higher percentage of patients that I see. And those patients tell me, okay, I want to see you for treatment of wrinkles. I don't want to worry about pimples, and yet I'm still struggling with hormonal acne.
Yeah.
So I am excited about our adolescent patients and young adults, but very much for women and men that are dealing with acne in adulthood. I think that this is a terrific tool to consider. I was hoping that actually we would do and have this conversation in front of the AviClear laser, but it's being used this morning, which is even more exciting, and therefore our technicians are working with patients right now. But from their perspective, we ask patients to come. Of course, there is no makeup to be worn, and the patient is treated. There, quite transparently, different levels of tolerance for different patients. Most patients tolerate the treatment quite nicely. So this is about a 30 to 45 minute treatment. Patients get up from the table and keep moving, so to speak.
Yeah.
So there are very little restrictions. I know that they can engage pretty quickly, same day in their regular activities. Is that what you have found?
Yeah, absolutely. I mean, there might be some redness, which is typical with any sort of laser treatment. Biggest thing is sunscreen.
Yeah, yes.
But other than that, yeah, I mean, I've done the treatment myself dealing with adult hormonal acne, and I come in, I do my treatment, and I'm out the door working on my everyday life.
Right.
It's really nice.
And Jen, I know that patients have been excited. You've been chatting with them about this.
Excited.
This is a non-insurance covered treatment, but we do have credit care, and we've really worked it out nicely that it's hopefully almost to all affordable. So as you see our providers, that is something that will be discussed during your visit as well. And since we are very focused on mental health, this is the week that we recognize as a practice. We very much support treatment of anxiety, depression. We are so cognizant how acne can play into it. So this is yet another tool. We want to be comprehensive in seeing our patients and really touch on so many different levels that we help you with. So remember, this is a great tool. Jennifer, all of our general dermatology providers are here to see you. We can't wait to discuss this with you, confirm that you are a good candidate, but it appears that almost everyone is. So thank you, Jennifer. Great to talk to everyone. AviClear is part of the October 20th fall event, 20% off, don't forget it, and we'll see you next Tuesday.